this is an abdominal exercise that is back friendly. If, however, you find whilst doing this exercise it starts to hurt your back, please stop doing it, come back and see your osteopath and ask them, and they can give you some adaptations and modifications for your particular back. So, as an aid memoir from what you will have been shown, laid on the floor on the bed, pillow underneath your head, we bend this knee up, and the next stage you do is you slide your hands underneath the small of your back into that resting position of the arch of your back. This puts your spine into the neutral spine, which is a small arch in the spine there. These hands will act as monitors to see whether you start to flatten your back into the floor, which is what we don't want to have happen. This would be the position for people with good necks. If you have a sore neck as well, we take one hand and we place it sort of bracing behind your neck there. So we're in the start position here. Now if you visualise, there's a piece of string that's attached to your sternum here, to your solar plexus, and that piece of string, get it? That piece of string is just pulling you into the start of a sit-up. Now that is as far as we want you to come. You see he's only coming just a few centimetres off the floor and back down again. And then come back up and back down. Now John was slightly holding it at the top there. We don't want you to hold it, we want you to come up and go back down in a nice cyclical movement. Okay? The things to watch out for, 3 faults on this one. Fault number 1 that we really don't want to have happen is you flatten your back into the floor. So if you're just putting, and you can see that pelvis is tilted that way and it's all become a bit bow shaped like that, and that puts a lot of pressure on the lower back. So maintain the arch using your hands as a pressure sensor. That was fault 1. Fault 2, you come up into a chin poke. So if you come up into a chin poke, straining these neck muscles here, and that's no good. So keeping it nice and straight, visualising this piece of string attached to your solar plexus, pulling down and along your abdominals and back up again. Not pulling you out this way, we don't want that, it's pulling you down and along your tummy muscles. Okay, so that was flattening your spine, chin poke, and the other one is neck rounding. So you're looking too far, chin is being tucked down here and you're looking at your tummy muscles. We don't want that either. Okay, perfect position is this piece of string pulling along this way, so the patient is coming up, elbows just slightly and coming up like that, and the patient is looking up at the sky, looking up at the ceiling. Okay. 4th fault, using your elbow as a leverage to help you lift up. But you could just show me a cheat there, John, by elbowing up. You've seen he's putting tension through this part of his upper body here. Okay, so that is stage 1. Stage 2, more complex. Please don't do this unless your osteopath has suggested you try it. You're coming up again, pulling up this way to that point there, and then you're bringing that shoulder point across to your pelvis here, and we're working these muscles in a line across your body. So you go one way and then you go the other way, taking care not to cheat by using your elbow as a leverage, not chin poking as you're doing it, and not neck rounding. Okay, so reiterating that one again, you're lifting up and you're bringing one shoulder point to that pelvis, working that channel of muscles across there. Okay, if you find when you're doing this you start to fatigue and feel pain in your back, your neck, or you start to feel what we call a wobble on and your muscles start doing this, it means you've done enough. Go back, rest, come back later on in the day. If you find as well whilst doing it, it starts hurting your neck or you feel tension in the top of your neck, you could try pushing the tip of your tongue into the back of the front of your teeth, and that often switches these muscles off and makes it more comfortable for you. And that's the abdominal exercise. And that was everyone.